there is really very little accountability for hospitals when it comes to boarding.
Welcome to the Built on Results podcast, a series of conversations about the issues, the advocacy, and the wins on behalf of emergency physicians. Dr. Jesse Pines is the Chief of Clinical Innovation at U.S. Acute Care Solutions and a clinical professor of emergency medicine at George Washington University Hospital in Washington, D.C. He says linking measurement to hospital funding would help solve the boarding crisis, a problem that remains a top advocacy priority for the American College of Emergency Physicians and its member chapters. This is Episode 3, The Root of Many Troubles.
Boarding has been a problem for 40 or more years. So this is not a new problem. What's happened recently is after the emergence from the COVID-19 pandemic, boarding got a whole lot worse. That was due to staffing issues in hospitals, capacity issues on the inpatient floors. And what happens when that occurs is that things tend to overflow into the emergency department where patients can't get inpatient beds and boarding goes up. The problem for patients is that when patients board in the emergency department, they are more likely to have complications and actually more likely to die in the hospital. So that's what this is all about is, how can we implement solutions that will compel hospitals to really address boarding, it's a fixable problem. Time and time again, there have been expert panels that have listed boarding solutions. Those exist out there. It's really a question of whether hospitals implement those solutions.
Your colleagues listening to this don't really need us to explain the problems caused by boarding because they are living those challenges every single day.
Yes, absolutely. Boarding is a big dissatisfier for emergency physicians. It's a big dissatisfier for patients. And there have been multiple studies over 20 plus years showing that boarding is something that we should want to avoid when it comes to hospital management.
What has ACEP been doing to address the boarding problem?
The big issue out there is that there is really very little accountability for hospitals when it comes to boarding. So what creates accountability is measurement and public measurement and linking that public measurement with real dollar incentives for hospitals. So that's really what ACEP is pushing now is, can we boost transparency through federal legislation? Can we create more accountability through national quality measurement, and particularly this new ECAT measure, Emergency Care Access and Timeliness measure, that looks at a number of different features of the patient care in the emergency department, from boarding to wait times to whether or not they left without being seen, and really sort of puts that on the map. And that's really, I think, what it's all about, and what ACEP is trying to do is putting boarding back on the map of public reporting, as well as real incentives for hospitals to fix this very fixable problem.
And for those who want to learn more about ECAT, we'll have that link in the show notes. But here, let's talk about how ACEP members were actually involved in developing ECAT. Tell us why that was important and why it's critical to have the emergency physician voice represented in these solutions.
So, emergency physicians live boarding every single day. So I think that the voice of the emergency physician is important to be able to describe the operational reality of what happens in hospitals every single day to policymakers, to make them aware of how big an issue this is. Emergency physicians also can correct persistent misperceptions that have been out there for years about why boarding occurs. It's not about low acuity patients overwhelming the emergency department. It's not about emergency departments being inefficient. It's a system-wide capacity and flow failure that emanates from how hospitals manage their inpatient beds. So emergency physicians, I think, are the primary source of being able to explain that and also have the credibility to be able to explain that to policymakers.
In late 2024, a summit was held. ACEP helped put it together. It involved the Agency for Healthcare Research and Quality, which is a part of HHS. Can you tell us why something like that matters, how getting together to discuss these issues can help lead to solutions eventually?
So, summits like this are incredibly important because it brings together multidisciplinary stakeholders to talk about these issues in a public way, and to be able to identify and prioritize solutions. Coming out of the summit was really the development of this ABCE Act, which is really sort of a concrete package that incentivizes really the biggest issues. One is having a real-time statewide regional bed tracking system to make sure that we are tracking what's going on and that the hospitals are sharing data. Two is about creating innovative models to focus on really the highest risk population, which is older adults with emergency care needs. And in that population, that's where we see a lot of the bigger issues with boarding, as well as patients with acute psychiatric need, and then finally, directing a federal study to determine some of the best practices for bed tracking and capacity management, and ultimately these are, these solutions have been talked about, but really giving hospitals a way to prioritize what are the most effective interventions that can help today, I think would have a lot of value.
We'll have a link in the show notes to more information about the ABCED Act, so go there if you'd like to read more about that. As it relates to progress on the proposal, what are you hearing? What's the status right now?
I think we are still far from having guaranteed success in this area. This is an area that requires continued education. We're also in a political environment where there is a lot of polarization, and getting Congress to agree on any legislation is a tremendous challenge, and much more so than it was 10, 15 years ago due to this polarization. So I think where ASAP has a big role here is keeping the foot on the pedal and continuing to try to elevate this issue, so policymakers will put it on the forefront.
If we could address the boarding crisis, what other problems facing emergency physicians today might also be solved?
Well, there are many issues that face emergency departments that are, caused by the crowded environment. So boarding is the central cause for crowding, and crowding has a number of other problems. So if boarding goes away, left without being seen goes down. So that means that patients who decide they can't wait any longer are going to have fewer complications. Another issue with crowding is that patients tend to be less happy and maybe more prone to violent episodes in the emergency department, violence directed against staff or other patients. So by improving boarding, I think, are going to create a much safer, less stressed environment in the emergency department for all patients, where the delays could be improved substantially. So I think that there are a lot of spillover effects that hospitals would see and emergency departments would see, and emergency physicians would see having better day-to-day operations if we were to address this issue.
Would a solution also help improve mental health among the physicians and staff in the ED?
Absolutely. Having a poor operational situation when you walk into the emergency department is an enormous dissatisfier when it comes to physician longevity in practice. Are physicians going to get fed up one day and not want to come back or want to practice a different type of medicine or do something altogether? The burnout that we feel on a day-to-day basis is really tangible, and this burnout has gotten a lot worse since as we've emerged from the pandemic, primarily because of the increase in boarding that we've seen, particularly in 22, 23, that continues today.
Every day from now until March 28th, we'll feature a different story about the work of ACEP and its chapters. We'll talk about advocacy wins and work still underway to make sure you can do your job. We kicked off the series on March 11th. You can listen to past conversations in the series and read more about ACEP's work to address boarding using the links in the show notes. There's also a website, acep.org/results. You've been listening to the Built on Results podcast, a production of the American College of Emergency Physicians. We're back tomorrow. Until then, have a great day.